Health alert tonight about new cases of malaria in the U.S. And here to tell us more is Dr. Shira Doron, the Chief Infection Control Officer for Tufts Medicine Health System. Dr. Doron, good to see you.
Good to see you.
All right, Dr. Doron. So nationally, the U.S. typically sees about 2,000 cases of malaria each year. But for the past 20 years, those patients were infected outside the country. So what can you tell us about these new cases? There's a big difference here.
Well, I'm glad not to be talking to you about COVID today. So what's going on here is that there have been 4 patients in Florida and 1 in Texas diagnosed with malaria so far, and none of them have traveled to another country. Now, this has happened before in 2003, so 20 years ago, with 8 cases in Florida. And luckily at that time, it petered out without becoming a long-standing problem. But some international health experts have warned that climate change could alter the distribution of various mosquito species such that we could start seeing malaria regularly in places that don't normally see it, and that would be a bigger problem.
For sure. Okay, so the CDC says the risk of local infections is still, quote, extremely low, and just 5 cases in 2 states seems isolated. So why would the CDC then send an alert to every doctor and hospital in the U.S.?
Well, the most important reason is that malaria can be very serious, even fatal. And we doctors simply do not consider it in patients who haven't traveled. It's been 20 years since we saw cases like that. So the main message from the CDC is to consider malaria and test for it in patients with fever of unknown origin, especially if they've been to one of the affected areas in the U.S. Currently, Florida and Texas. That also means having malaria tests and treatments available in clinics and hospitals that don't normally see people who tend to travel outside the country.
All right, so since the risk of malaria is still significantly higher in other parts of the world, what do you want travelers to know about prevention and symptoms?
Well, people traveling to parts of the world where malaria is endemic or widespread do need to take precautions. Even if you are returning to a country where you used to live years ago, your immunity has waned and won't protect you. So your best bet is to go to a travel clinic before your trip to talk to a specialist about whether you should be taking malaria prevention pills and to get counseling on how to avoid mosquito bites, including using bug spray, protective clothing, bed netting. And then if you come back from your trip or if you're on your trip and you do develop a fever, then malaria is one of the considerations.
All right, Dr.